So it is about targeting. All of these things actually affect how our metabolism. So it gets spiraled downwards and our metabolism gets sluggish. Our hypothalamus, which is and I'll talk about that, is the gland in your brain that controls your metabolism and all the rest of the endocrine system in your body. It gets revved downwards. And then so therefore you only have to look at food and it goes on your hips. Who experienced that? They have to hold their breath. I've got patients who walk by McDonald's where hold their breath just in case it gets on their hips. It's frightening, isn't it? So this program is about, it's just a fat loss program that is designed to take care of some of these factors that we're going to talk about, in terms of being aware and what's holding you back. As we know, being overweight is quite an epidemic now. There are more and more people who have this problem. And I wonder why. There's 62% of adults are actually overweight or obese. That's a massive problem. It increases your risk of heart disease, diabetes, all of those medical related conditions. And we're all going on medications to help that. But actually you have to address the cause. So over a total number of overweight obese people last year was 7.4 million. So that's staggering statistics. And the worst thing is our children also are getting more and more overweight as well. And a BMI of 25 over 30 is actually considered overweight. So there's some of the reasons. It's not good, is it? And obesity is big business. It's actually a $150 billion business. So when you think about that, who do you think controls the weight industry? Commercial companies with big money, okay? Dairy farmers, they control the food industry. So you actually have to be aware of that so that you know how to make the decisions that are going to affect you. So it's a problem for everyone except for those who are suffering from it. And these are all the obesity or weight complications that you can set yourself up for. Dementia, cancer, type 2 diabetes, sleep apnea, depression, arthritis, back pain, surgery complications, stress incontinence. Gee, the list goes on. And then people go and try and treat those with medication. Okay, and the doctors will go and tell you, Joe, just go and lose weight. Yeah, easier said than done. And that's the challenge. What kind of treatments we get? All sorts of medication. Anyone been on those? Some people have tried them, Reductil, appetite suppressant. I think drugs to stop you absorbing fat, but then you can't absorb the fat-soluble vitamins like vitamin A and vitamin E as well. So it sets you up for a whole heap of problems. Diuretics, thyroid, I mean, they've tried all sorts of things. What about gastric bandage? Some people go and try those as well. The problem is the complication's quite high, and then you can't eat the food that you love, even the good food, and you end up eating slurpy, sloppy foods like ice cream. And the complications, are quite significant. So there's some insane treatments, like even they've resorted to wiring your teeth. There's actually a jaw wiring focus group if you want to join that. It's amazing, isn't it? So I'm just going to introduce you to this doctor called Dr. A. Simmons, who actually was born in the 1900s. And he was the one that developed this treatment that I'm going to talk about to you today for controlling weight. And he was a very famous doctor, and he actually, he was renowned for, he discovered the anti-malarial drug Atobrin and discovered the stain for detecting malaria that bears his name. He had a lot of distinctions, and so he was well recognized. And what he found out was that overeating is the consequence, not the cause of obesity. People think, oh, you just overeat, you should stop, you should reduce your calories, but that's actually not the problem. Okay, there's a reason why people have an insatiable appetite, where they get hungry for no apparent reason. Okay, and the hypothalamus is a responsible organ for obesity or for weight issues. And obesity displays physical signs that are characteristic to this disorder. So we're going to talk a little bit about that. And he was a visionary because he spent his lifetime treating overweight patients. And patients flew from all around the world, the rich, the famous, the actresses, the millionaires. They came to his clinic in Rome and got treated on his program. And what he discovered was a hormone called HCG. Anyone heard of it? Yeah. It's a pregnancy hormone. And it's actually, he accidentally discovered, and he discovered in India when he was giving it to some pre-pubertal boys, and he found out that they lost a lot of fat. You know, so he translated to using this hormone in his overweight treatments. And this pregnancy hormone is the hormone that allows a pregnant woman to direct their body fat metabolism to burn fat so that the fetus could survive, in spite of the fact that the food intake may vary. So if you've got a pregnant woman, what if the food didn't come in for days on end? Then the mother would still be able to feed her baby by burning all the abnormal fat stores that was around. Any spare tires that she was carrying got burned straight off because this pregnancy hormone allowed you to do that.